Okay, everyone, we're going to go ahead and start. I'm going to call this meeting to order at 11:37. My name is Colin Rodriguez, and I am the chairwoman for the Alcohol Commission. So right now, what I'm going to ask for roll call purposes, we're going to go ahead and just make mention of your name, and if you do have a position with the commission, please mention it.
Marina Moreno. Precinct 3, John Galo.
Nancy Cadena, appointed by Commissioner Guadalupe Harina.
Guillermo Walls, Health Department, City Liaison.
Erica Lopez, Health Department.
Elisa Seca, Health Department. Jaime Perez, Health Department.
Christina Duarte, Health Department.
Jerry Soto, Fire Department.
Jesse Hernandez, Commissioner Jesse Gonzalez. Mayor District 2, Mercurio.
Margarita Garza, Precinct 4, Cindy Gando.
Freddy Formula, District 8, Alyssa Sinaloa.
Health Department. Teresa Cabello, Scan. Jessica Gomez, Scan. Clara Gutierrez, Scan. Serena Villarreal, Border Region. Catalina Navarro, Border Region. Norma Monsiváis, Border Region.
Andres Maciel, Liberty Police.
Thank you all so much for joining us. We are in a comfortable space. Thank you, Mr. Walls, for making it happen. The meeting is being recorded, and we are like at a 360 or whatever you want to call it. We go all around, so whoever's talking actually is featured on the camera. So just wanted to make mention on that. So if you started like side talking, you're going to be on the camera. But okay, so moving on, very important. I do appreciate you all making the RSVPs and the forum. Please, whenever the emails are sent out, I know it's kind of early to plan, but we will set up the next meeting date, and we hope that you all could ensure that your attendance is RSVP. So make sure that whenever you have confirmation to RSVP, so that we can plan accordingly for meeting space and for food. Mr. Wilson, can you be signed up for public comments?
Okay.
Thank you. Moving on, we have the of the minutes for August 10, 2022. If you all got your red notebooks, which I didn't see out. If you all have your red notebooks, commission members, I do need a first and a second as soon as you all review the meeting minutes for August 10th. If there are no questions or revisions, could I please have a motion?
I have a motion to approve.
I have a first by Jesse.
I'll second.
Second by Margarita. Thank you. All in favor?
Aye.
Any opposed? Motion passes to approve the minutes. Moving on to administrator's report. Mr. Walls, do you have anything to report?
From the county, I guess basically on the detox, everything is going as planned. Right now, they're working on suspended ceiling and wiring, installing metal studs, air-conditioned ductwork, air-conditioned electrical lines. There's a lot of trenching going on in the facility. There's sheetrocking, floating taping, and installing plumbing. And the county estimates that they should have a certificate of occupancy by the last week of April, first week of May of next year.
Are we still on track for the most part regarding the facility?
Yes, ma'am.
Awesome. Thank you for that. Moving on to discussion and possible action, some of which we may have to table, but we do want to have some discussion. I know that we have some of the stakeholders. What we've been trying to do is grow the commission now that we're back into meeting in person as opposed to online. So we do appreciate Laredo Fire having to be here. They were here last month with a presentation that was very informative. We would like to hear from most of our stakeholders on a monthly basis to know what some of those issues, reports, or things that are going on with your agencies on a regular basis. That way we are kind of in the know, because while it's there, we don't know it's there unless we're asking for it. So we'd love for you to be part of these meetings so that we could obviously be the people that go out to city council to discuss it with our leaders, to bring those resources to you guys as you're all helping with our mission. So on the agenda, I do have a combined agency event. What we had planned to do was in October, to do an event, the way that we had done it way back when. At one point, we got together at the mall and we had all the agencies, represented, and we had a Loteria theme. And so the idea was that, we passed out cards and they would get punched hole through the different agencies and then they would be eligible for rewards like at the end of the event. October's come and gone, November's come and gone, December's going to come and go. And so I just kind of wanted to hear from everybody, depending on your availability. We are planning ahead, hopefully 6 months ahead. Would you all consider another month to do an event? I've reached out to the mall, I've reached out to the outlet to be a part of events that are already coexisting. So for example, the outlet has the farmer's market on a regular, on a monthly basis. So they're very well attended. So the idea is that we would get that group of people to come and visit with the booths to learn more about our agencies. And it's more of a one-stop shop, getting to know all of us and then some. Does anybody have a recommendation for a month so that we can start looking and planning for it? I'm open to suggestions. A month that's not as busy or as occupied, or that we can tie in perhaps to another event. April is Alcohol Awareness Month, and I do know that April is also like a lot of awareness. March is also a very good month because spring break is happening. May is mental health. So is there like a month that you all foresee maybe growing it into a nice little event that would bring awareness to the public?
I think April or May would be good, because of the alcohol and the mental health, we could tie that in.
Okay.
They just seem like calm months in comparison to the holiday season and summer months, so things like that.
Okay. Any other feedback from anybody?
March is good for the outlets because of the weather, and she said April, May is good for the mall events
Okay.
for the weather.
I like March, the spring break, if we want to try maybe.
Okay. So what I'll do is I'll look at some of the other agencies to see if maybe perhaps SCAN's already planning something. That way we don't conflict with other events, also with the city health department, to see if there's events that are already planned ahead. That way we can collaborate and then kind of finalize the date. So now that I know that anything between April and May, I will find out what the availability is from both the mall and the outlet, and then bring it back at the next meeting so that we can already finalize the date and then pre-plan and schedule that event. Thank you all for your feedback. Moving on to subcommittee group calendar planning, we are still going to stay on board as commission members up until the time that the new mayor or new city council members are taking their role and they appoint somebody new. We do have some subcommittee groups that have already been established. We are going to go ahead and send out so that we can re-establish those groups. I know that we had the outreach and prevention, the outpatient and mental health subcommittee groups to discuss with other agencies and stakeholders. We are still growing the commission again, so we will hang tight on that planning, but hopefully coming back after January, we're able to meet on a regular basis. Does anybody have any comments or perhaps a interest in creating a new subcommittee that might be of importance?
Can I just address something that's been on our committees?
Yes.
That's stopped since August, I think the last time we actually had an official meeting. And that would include, that I would hear Margarita, Anna, Kika's not here. And we do the treatment, substance use treatment, detox residential, and the co-occurring psychiatric substance use disorders. If anyone wants to join in, just email me or text me. The more the merrier. I can let you know where we're at. There were some issues about how the detox was going to be run. We had a whole discussion about that we were going to follow Chapter 448. the rules that apply to detox. And, we're gonna make a presentation about those rules to the city council and the county commissioners. And, so they're informed as to how this detox is gonna operate once it's built and once we have someone that's gonna operate it, along with the recommendations we have, including some of the protocols that we've talked about for those clients that are opiate addicts, that want to use Vivitrol. There's going to be a crisis stay for 14 days so they can get the Vivitrol shot. We talked about that. Alcoholics could also have a crisis stay so they can get on the Vivitrol shot. We talked about that being as part of the protocol. So I wrote that up and it's still on my desktop since August. So my suggestion is once the new city council comes up and we have time, we can present this to city council and the commissioners. And that was the last thing pending. And of course, the discussion is also how we can incorporate mental health. That's a big thing to me. I've worked with cocaine issues for close to 35 years. So, I started off at Rare State Center, which is now Board of Regents, so all of that very close to my heart. So anyone that wants to join, you just email me or text me. Some of you may already have it, and we'll start up the group again. The only one that I will see here right now is Kika, but so far this is a group plus Kika. But he hasn't been here for a while, so if anyone wants to make it, please let me know. Marina is the other one. Marina is the other one in the group. All right.
Thank you so much, Jesse, for that update. I know that, the holidays are gonna get in the way. Just kind of start looking or sending recommendations or feedback to Jesse and the groups. I will get with you all, make sure that you've all signed in and you've all put your emails legibly so that we can add you to the email list. And then that way we can send you all that update on the subcommittee groups. And then we're going to ask you to recommit to those subcommittee groups, and then coming back into meeting regularly in January, we'll figure out whether we're going to meet online or we're going to meet in person depending on the groups. For example, with regards to the combined agency event, that outreach event would fall under prevention, and so the prevention group would be assisting in making the event come through. So that's just an example of what the subcommittee groups would be doing moving forward.
One final thing where we were at in our committee, we had already been operating on phase 1, which is the detox, and we already started discussing phase 2, which is a possibility of building the residential treatment program right there in the area of the detox. We've talked about that before in previous meetings, and so that's our phase 2, where we do want to see if we can somehow get another residential program right there next to the detox. And of course, all of that's going to, all of that would be, there's going to be a provider that will do it. We're not calling that, but it's important for stakeholders to be here. I'm always happy to see, whether it's for the region or SCAN, they're here pretty much all the time, so I appreciate that this is an idea. This is best.
Very important that you all do come through and show up. So I was looking for the email, and it's prevention, outreach, education, intervention, treatment, rehabilitation, detox, transitional support, which we added mental health to that one, and then transition and aftercare. So those are the subcommittees that we had established initially. Obviously, things change, times change, needs change, but very important, I think, that they all fall into a category. So yes, you can be part of multiple groups. If you feel that your agency is going to either benefit or provide some form of benefit to the community regarding the work groups that we have, feel free to sign up. The idea is to kind of be in the community providing the resources that you will provide alongside the other resources that are collaborating with the city. So we'll send out the work group document, and then you can go ahead and sign up and put your email and or contact information so that we can go ahead and add you to it. Thank you, Jesse, again for that update. Is there anybody else that wants to give an update regarding the subcommittees? Moving on to the roundtable meet and greet event, again, in essence, with what I've been saying, the idea is to grab all of our stakeholders, to grab everyone who is working towards the mission of the Drug and Alcohol Commission, again, with the city and with county. We have discussed having to meet perhaps at the library. We're meeting here even now that we have this nice little setup here. The idea is to reintroduce each and everybody's agency, all the stakeholders into the group. So for example, SCAN would come in and say, you provide these services. We have these many employees. Our biggest setback is this, our biggest achievement is this, right? Keeping it simple to a couple of questions and having each agency be represented and inviting new agencies to come in and learn what other agencies are doing, because what happens is that either they don't know that there are those resources available to them, or that they feel that they're intimidating that they can't work with each other. The idea is that SCAN at one point used to do the directory resource, and I know I have gotten something already with the tropical group having to send me the information, but I know that there's new agencies, new nonprofits, and that would be the idea to make a formal invitation to invite them all to come in and answer those 5 questions and do a quick presentation. So again, that's something that we wanted to do, and it had been brought up. So if anybody has a date in mind, or maybe perhaps a location, please let me know so we can already start planning that and getting that word of mouth out there. And that would be more of a stakeholder nonprofit agency meeting. We want to consider doing it maybe that one in January, February, March, like first of March. But that would allow if anybody's coming in as a appointee. And so this is just a reintroduction. We're doing reintroduction because things are transitioning, and the idea is that I may or may not be here, Nancy may or may not be here, or you won't be here. There's a couple of people that may or may not be here. So the idea is that it doesn't stop. Like, we continue with our momentum and the traction that we've had and continue moving forward. I will be here, if anything, with the Crime Stoppers and in that capacity. But there are other people that we want to bring in so that they could bring in those resources. So March.
May I say one thing?
Yes.
First of all, I want to thank all the stakeholders. It's very important to hear. This is a different process that we had in our previous iteration of wanting to do this. This has been more grassroots, I think. And from when we started this, I appreciate not only the City of Laredo Health Department for all the being there, but for the region, and especially staff. I remember he said it was here for the first meeting. And we have a lot of agencies here. But I want to thank you all, because you are the ones that have consistently showed up. Whether it's one or who can you do, whatever. Our community needs more of the providers in our community. And I want to thank you, because when we get this detox right, we're going to need you all. We're going to need your expertise and skills. I'm 65 years old. I'm not going to be doing this. My mom did, Brian, but you guys, some of you that I have worked with for years and that I have had the pleasure of knowing, you are the generation for this. Okay.
Thank you. And again, that is why we're wanting to integrate these meet and greets and these outreach events, so that actually happens, that we're actually providing the information into the community, because you are the ones that meet with them on a day-to-day basis, and for that we appreciate you. Moving on to the next line item, which is going to be the nomination and election of secretary. We discussed at the last meeting, which was not met by quorum. Ms. Nancy, due to work, had to step down as secretary. She will still be involved with the commission. However, the role of secretary, she's had to let go. So if anybody in the commission that may be interested in being nominated and elected for secretary, your role would consist of writing the minutes and ensuring that quorum is met for the most part. And that is assistance that you all will get from Maria, Mr. Wallace, or myself. But we do need to have a formal secretary. So if anybody is interested, please let me know. Raise your hand if you'd like to be considered for the position. Not all at once. Unless you have to be a commission member. Okay, so if we don't have anybody at this meeting, we will go ahead and put it out there through email, and hopefully by the next meeting we have a secretary. Meanwhile, Maria and I will work on those minutes. But please, if anybody's interested, let us know. We need to hire someone. Moving on to the detox facility update, and I think Mr. Wallace has already given that update. Is there anything in addition to what you provided? We're good? Okay. The stakeholder agency updates and presentation. We'll go ahead and take agency updates after the presentation. For now, we're going to go ahead and resume with the City of Laredo HD AOT presentation, and Erica is going to provide that for us.
I'm going to stand up now. Everybody has a full view of it. So that's the green part. So my name is Erica Lopez, and I'm part of the assisted outpatient treatment. We are relatively new. We are in the implementation process of it, but we are very, very excited to get out there and help our community, especially with mental health. So the assisted outpatient treatment, AOT, is a practice of providing community-based mental health treatment under civil court commitment. So this makes us a little different from other agencies where this is involuntary outpatient services. So it might be for those individuals who have a history of hospitalizations and they're very non-compliant once they're discharged from the psychiatric hospital. So this is where AOT comes in. So our referrals to AOT. So everybody has to be court appointed. It has to be, the judge has to go ahead and sign a court order, but we will be getting referrals from a lot of different agencies. We foresee all of our referrals coming from hospitals, whether it be psychiatric hospitals or our ERs. Myself, along with some other individuals here, we've done crisis. We've been at the local ERs where the individual does not meet criteria for inpatient hospitalization, or they stay on the wait list for a very, very long time. So what happens is they do meet outpatient services and they do not follow up. So we will be accepting referrals from hospitals, more than likely the ERs and psychiatric, but they would still have to go through the court process. Our law enforcement, luckily we do have our LPD mental health team. They are amazing. Sergeant Garcia has been at every single meeting with us. They will have a space with us at our AOT office, and they're very involved. I also spoke to Sergeant Gordoa from Webb County Mental Health Team. She's, I believe, the interim right now for the mental health team, and she is on board to helping us, again, 100% with this. So a lot of the times, they're faced with individuals that have mental health illness. It is not a crime. They're not really committing a crime as much as just being maybe like a nuisance in the community. So instead of them being taken to the jails or being incarcerated, they can also be referred to our AOT program. Also our community. So as a lot of us know, when it comes to mental health and substance use, it doesn't just affect the individual. It affects families, children, work, school, the community in itself. So a family member can make a recommendation for their mom, for their brother, for their sister, for their child, if they're over the age of 18. And they can go ahead and make the recommendation. We will have a court liaison readily available to help with the application process, since it can be a bit overwhelming, and that they can go ahead and go to the judge and hopefully get this signed, and they can receive the appropriate care. And more than likely, it would be our criminal justice system. We had a very successful meeting with our DOH Chilolanis, as well as with Judge Taro Tijerina. They are supporting AOT 100%. They do see the need in the community. Mr. Olani said he was willing and his team to review the cases, drop any charges that might make them ineligible for our program. So we are looking forward to meeting today with Will County Attorney Mark Montemayor, so he can help us as well with this initiative. This program has been extremely successful in Bear County, Travis, Harris County. Judge Kingston actually from San Antonio started AOT in Texas. And he's willing to come down here, advocate for it. He went to law school with a lot of the attorneys here, a lot of our judges here, so he is supporting this 100%. So AOT criteria, the person must be 18 years and over. The person requires outpatient mental health treatment to prevent a relapse that would be likely to result in harm to the person or another. It could be relapse as in inpatient hospitalization, or it can also be relapse into the criminal justice system. The person is unable to participate in outpatient mental health treatment effectively and voluntarily. Although the recommendation once you're discharged from the psychiatric hospital is outpatient, a lot of the times they will not follow up with that. How I try to tell everyone is when they leave detox, that's when they have the highest percentage of relapsing. Why? Because they feel that sometimes they can use the same amount that they used to, or just feel invincible at that time. And sometimes that happens as well with their psychiatric patients. They might feel, I'm cured, I'm fine. I was at NICS for a week and now I'm feeling great. And they do not follow up with their treatment. They do not follow up with their outpatient. And what happens? They end up relapsing and going back into the hospital. And that's what we're trying to avoid with AOT. Skip. So this was, yeah, before now. Next one. So what are some of our AOT services? So we will be located on West Village, moving in hopefully soon. What this entails will be intensive case management. So our caseload would be a maximum of about 30 to 35 a year. We do have 3 caseworkers for these individuals, so it will be approximately about 10 cases per caseworker. They will go ahead and meet with them weekly in person and will make a telephone contact at least once a day. Aside from that, they do have access to our telepsych doctor every 15 days. So in the event that their medication isn't working, that they're having some complications or some issue, they do not have to wait the 3 to 6 months. They will be seeing them, if need-based, every 15 days. We will have an LPC as well on site to go ahead and provide any counseling. Primarily, it will be individual. There will be times that it will be family-based. We're still playing with the idea of group therapy, but for now, at least the first year, we want to focus on individual and family counseling if need-based. We also will have medical care provided there. We have a medical office assistant ready to help out as well, and we will be in partnership, of course, with the health department, and they will be treating any medical needs. This comes all together. Sometimes you do have a medical complication, and if it does worsen, it can come off to have some symptoms that are psychiatric, and it has nothing to do with psychiatric, it's medical. A lot of the medication prescribed, especially antipsychotics, they do affect you medically. High blood pressure, you gain weight, some even say like, I can't stop eating with the medication and now I develop diabetes. So we are going to have a doctor that's there available for them. And the beauty of this is that they will remove the stigma. It is integrated care, so they do not have to go to their PCP and let them know I'm schizophrenic and I'm on medication. They will not feel that shame, that stigma that unfortunately still surrounds the community. Why? Because our doctor will have access to their medical records. They will already know if they're there, they need to talk to the counselor, they need to talk to the psychiatrist, which is telepsych, it is available. Also, we will provide linkage to care, so we will help with either job applications. We do have funding to go ahead and bring them into our office to provide a taxi ride to their job interview. We're working on a donation closet where they have outfits available for interviews, for PTA meetings, for Meet the Teacher Night. We want to go ahead and just make them as comfortable as possible to go out there and have that confidence. So this is some of the linkage to care that we'll provide. Post-discharge, our program is approximately 6 months to a year, depending on the severity. We will go ahead and link out, whether it be to Board of Regents, SCAN, our Safe Home Dose program. And And the American Psychiatric Association recently concluded that involuntary outpatient commitment programs have demonstrated their effectiveness when systematically implemented, linked to intensive outpatient services and prescribed for extended periods of time. Hospitalizations for our AOT clients have gone from 74% to 37%. So that alleviates a lot of stress on the community and also financially. I know we do not want to say, well, mental health is affecting financially, but it does. Our Webb County mental health team, they pretty much do transports every single day. If we're able to reduce that, then they will be able to serve the community a bit more when it comes to the mental health aspect of it, as well as PD. So overall, this is we have the funding, and it is very cost effective for our individuals to be involved. We know a lot of our other stakeholders have right now an issue where they do not have staff. They are unable to meet the need. Luckily, we are able to provide intensive case management. We're able to talk to them daily. We're looking into providing cell phones for each of our clients so they can have that communication. Sometimes we hear them, well, I applied, where are they going to call me? I don't have a cell phone for them to call me for a job. So we're trying to reduce every single barrier possible when it comes to medical, the clothing, transportation. I will have a computer to do an application. Our caseworkers will help them and guide them to finding these applications and to hopefully sustain themselves slowly into the community. So I did leave my contact information. My email is elopez2@ci.laredo.tx.us, and my number is 236-9697. I know we are slowly in the process of meeting with a lot of the stakeholders out there. So I might reach out to different stakeholders to see if we can set up a meeting to see how AOT can go ahead and help and collaborate together to help the population. That's it. I don't know if you guys have any questions.
Erica, thank you for the presentation. It was wonderful. When you mentioned court commitments, are you specifically working with any court?
Nobody's been super eager to jump on it yet, so it will probably be the civil courts.
Okay, it'll be civil court.
Yes.
Okay. One of the things that I do know is Judge Knotson has always advocated for mental health, and she has a mental health caseload. Am I correct? She has a mental health caseload, and I know some of them are filtered into Ward Region. Ward Region, but you have those clients that fall through the crack that she may have, and so I would suggest that maybe part of your discussions will be with Judge Knotson to see if there's anything your program can do to assist.
We've met with Judge Knotson twice already, and they're pushing us more towards the civil courts.
Right, but I agree that she's not going to probably do that, but as far as referrals.
They're still pushing us just 100% to civil.
Oh, really?
Yes.
Oh, okay. Well,
Yes, so that's where we're meeting today with Mark Montemayor to see if he can also provide some guidance, simply because none of our clients can have pending charges. So that's where a lot of the criminal...
that's the issue, okay.
Yes, that's the primary issue, and cannot have any criminal charges.
Yeah, now I'm...
The complaint,
Yes.
right,
Yeah, there you go. That makes
They
sense.
can be on probation, and they cannot have any pending charges.
Oh, that
Yes.
That fixes all of the.
We're relying on, hopefully, Judge Guerrero and Judge Martinez to...
Well,
But it would be the same thing, because they would have charges pending in the courts with the county, at the county court level. I'm thinking maybe more, about like ticket violations with
with the...
Judge Dominguez at the
Yeah,
municipal court.
with the municipal court?
The thing is that they do not have to have any criminal justice background. So like, let's say, for instance, the individual, the way they do it in some other cities, smaller cities, is they're hospitalized again. So Border Region gets notified that, let's say, Jesse gets hospitalized for the third time in 6 months. They would go ahead and notify us, and we would work with our court liaison, fill out the application already, which we do have a psychiatric evaluation, which is valid for the year, and we would meet with the judge to advocate for this person being admitted to the AOT program.
Yeah, I think with some of the programs I evaluated during the COVID time period, when it was really bad, we had to switch our strategies, and Judge Dominguez was very helpful because there's a lot of people that go to his court that have, minor issues, but they do have substance. And that might be, I mean, that really helps in the programs that they're not doing that. Might be a way to start, just a suggestion.
No, and we appreciate it. We're literally trying to target as many people as we can to see what works for our community. Look, that's the beauty of it, and the scary part of AOT coming to Laredo. It's brand new, so we can mold it to what works for our community. But then at the same time, it's a blank slate, so we're like, we need to figure out what works for our
What's
community.
the age?
18 to 65.
I'm sure you're gonna do that. Where are you located on that?
On West Village, Springfield, you turn to the left on West Village, Palm View Plaza.
Okay, that's, I know.
Yes, we're there on the second floor to the right.
Thank you.
Sunset. So we have $4 million for 4 years.
It's Samson funding from what the agency's not, the CSAT,
How they can protect.
Mental Center for Mental Health Services, CMHS, or that's right. CMHS, yes. It's not CSAT, it's CSAT, it's CMHS. Which, by the way, City of Laredo had a CMHS program many years ago. I wrote that. Great services and the important City of Laredo part of it. So, yeah, that's what it's been.
So sometimes I get random calls at the office asking if we could assist a certain family member that is in need of substance abuse and mental health services. Our program is strictly through the criminal justice system. They have to have a charge pending. They have to be on probation. They have to be on a pretrial diversion program in order to qualify for screening purposes. But I have had phone calls where I'm having to refer out to Ware Region to scan, because these once I look into their criminal history, there is none, and I can't help them anymore. So those individuals, can I refer them to
Yes,
you,
as
and then
long
you
as-
take care of everything
Yes,
else?
as long as the primary diagnosis has to be mental health, following secondary substance use. They can't be primarily substance use.
Well, I would refer for the screening, then I wouldn't do the screening and then refer over to you. In my process, really will actually stop at the criminal history. So if there isn't anything pending, then I don't move forward with a clinical screening with my counselors. I can probably then just refer back to you and say, hey, this person may qualify, do you have any pending charges? Can we do the clinical screening? Yes, of course. Qualify.
Yes.
Okay.
So this is really more, when you look at quadrant care, you look at more of the quadrant care number one. That's severe mental health, or actually quadrant care two, more severe mental health.
Yes, there's substance. Yeah.
So you're looking for quadrant two clients, so for anyone that works with those clients, that's where you see.
Yes. So we do have a meeting with Puerto Region on Monday to discuss, since they do get all the hospital discharges from the psychiatric hospitals. We have a meeting with them on Monday to discuss, to see if we can develop an MOU with them and hopefully get started with their population.
Again, folks.
Thank you. Thank you.
Thank you for that presentation. Do we have any other questions? Questions, comments, concerns? Erica, real quick on regarding the referral. So let's say that they refer to your program and then you're not able to help. How are you able to transition this back into
We
what
still
they need?
provide the referral. So let's say the primary reason that the parent is calling us, like let's say with the substance, then we would try to refer them either back to Puerto Rican General CDCs or to SCAN. So we would provide still a referral. We won't tell the parent like, oops, so then we have criteria, like you're on your own again. No, we would go ahead and try to find the appropriate agency that will.
How many staff members are part of the team?
Right now, it'll be 3 caseworkers, 1 health educator, peer provider. We have a clerk, medical office assistant, an evaluator, an LPC, and we are working on getting a court liaison as well, myself, and the doctor.
Congratulations, and we hope that there's much success with the program, because again, the community needs it, so appreciate that. Moving forward to the next presentation, we have Chief Maciel with the Laredo Police Department, who is going to be talking to us about drug overdose and some of the things that they've seen on their end.
Good afternoon, everybody. I just wanted to provide a brief overview of some of the overdoses that the city, that us as the police department has been responding to that have resulted in deaths. This is for this calendar year, and we look at it closer because of the alarming trend that we have doubled pretty much from last year, 17 deaths, and now at the end of October, 32, and that number has changed really this past week. We're probably at about 34. What's the change? What's the cause of it? Where we were previously not privy to until, months and months was toxicology reports. Those take a long time. Now, as some of those reports have come in from the beginning of the year, we're seeing the introduction of fentanyl into a lot of these drugs. And that's been the primary cause of these deaths. Laced in marijuana, pills, primarily cocaine and heroin. And most of these deaths are attributed to habitual users. We have had some that have been off drugs for a while, and then they come and do it again, and it's too much for them, and of course the result is an overdose death. So combined with us, LPD, the health department, and the fire department, we've started a big campaign on not only on awareness, pretty much in each one of us doing our own part. Health department has taken the lead in creating an awareness campaign and working with all the other agencies and stakeholders. And together we've started doing presentations at the schools, at the colleges. Mr. Rey Soto here is part of the leadership from the fire department that they're doing. They're doing primarily on what to do of an emergency, of an experience of an overdose, the emergency response, the life-saving techniques. And just to also show the age range of these deaths, primarily male. The ones that are concerning and are the lowest age group, 17 to 24. We have not seen, and this is information that LPD captures as a response to the field. We probably are not seeing what goes to the ER and stays there unless PD is called. So there's probably a lot of data that we're probably not seeing. So these are the age ranges. And as I explained, the response, the community-wide advocacy and awareness from health and fire with all the school districts and advocacy groups, which also included a combined media campaign. I shared some of the work that the health department did, the artwork for the awareness campaign. So what is LPD doing? And that's a big question. What are we having to do different now to put a bigger dent on this? Like I said before, we would have to wait for a toxicology report. By the time we go back, an investigative process is kind of late in the game. We didn't have the resources to get whatever substances that we recover at scenes, whether it be a syringe, a foil paper with powdery substance, to get us a fast report on the substance. So now we have relationships with CBP. They have local scientific instruments that can give us almost an immediate results of what the substance is. Also with the DEA, they fast track their lab for us, so we can send and get results on the stuff that we recover. So with that, we're able to work an overdose death as a criminal investigation. So that's where we're going. No longer like in times before where, unfortunately you respond and it would be classified as a death, but now we still need to do a follow-up. Where is this drug? Where are these drugs coming from? And additionally with DEA, we're able to classify chemically or scientifically the chemical composition of that one drug. and link them with other busts, recoveries, and we can kind of group those organizations together. DEA is also helping us in do federal charges on some of these individuals who are supplying this poison. So, and aside from that, also with the district attorney's office, they've also been very aggressive with us in prosecuting these offenses and primarily bringing down these organizations or these tienditas, as we call them, that are the local distribution networks in our city. Where is this coming from? Of course, this is all coming from Mexico. We have not seen, you've seen in the paper where they do seizures of fentanyl in large amounts, but that's crossing, primarily all this is done in Mexico, processed and packaged in Mexico. So it's pretty much spread across all the types of narcotics that people can abuse. So that's why we're saying, be careful. I mean, and I think Mr. Soto can also expand on some of the items that are out there that are being recommended for people who, I guess, there's like test kits to to see if, and it's kind of weird, and now we have to say, what am I ingesting? Is it really cocaine or is it laced with something? There's actual kits out there for that. But this is just an overall of what we're seeing, and we wanted to share this with the group. And we continue to fight this, and we're trying to get as creative and as aggressive as we can to get to the source. Unfortunately, by our very location on the border, drugs are easily accessible and cheap. So it's a constant battle. But that's all I had in case anyone had any questions or concerns I want to share or anything. But as always, we're very active on this, especially the areas where it's more prolific around the downtown. The downtown area is very prone for drug use, combined with homelessness and all that. So we've identified with the dealers that supply downtown. It's usually your neighborhoods around it. So we've had a lot of success on some of those, but it's a constant battle. It's a constant battle.
Thank you, Chief, for the information. Adding on to that, through Laredo Crime Stoppers, we've actually had, and it's a true factor when we say that narcotics is a major thing in our community. It's been a major issue for the longest time, and with regards to Laredo Crime Stoppers, that is one of the calls that we receive the most on. As a matter of fact, I wanted to share that similar to this, because I know that Mr. Soto and the fire department were over at the UISD Parent Summit over the weekend doing presentations to parents and students, and so was Crime Stoppers. And we always get those questions on what types of drugs are the kids, using nowadays, and what are they supposed to be looking at. So we did touch base on the vape pens and fentanyl, as you probably were talking to them as well. But we did receive a tip. I want to say it was actually August, September. In September, we received a tip that led to the surveillance in which officers managed to secure the necessary evidence for a search warrant. Officers seized 944 THC cartridges, approximately valued at $28,000, 2.4 pounds of marijuana, 2 assault rifles, and $54,000 in cash. 1 male and 1 female were arrested on state drug charges, and this reward was actually, or this tip was actually rewarded $800 at our last Crime Stopper meeting. But I wanted to share that with you all because it was 944 THC cartridges, and that's actually getting into the hands of our, schools, our students, our juveniles, our kids, and so it is a major issue alongside, the now more prone, unfortunately, fentanyl is being laced in these drugs, and it's a scary thing out there. So awareness and prevention is definitely necessary, and so that's why we're going full force on it. So I do appreciate the efforts of the police department and the fire department having to go out there, do these presentations, and bring that information back to us. I don't want it to go in vain where Mr. Soto's presentation last month was not reported, so to speak. So I do want to put you on the spot and just touch base on that presentation that you gave us. That way, we do have it on record in minutes, what we discussed about fentanyl.
So what we discussed was, it was prior to Halloween, so the big rage was rainbow fentanyl. You know, rainbow fentanyl, the DEA put out a bulletin saying that they're targeting the kids, but all the data and the research indicates that the reason that it's multicolored is, like I always tell everybody, what kind of colors of pills do you find out there that you take prescription-wise? What colors of pills do your parents, grandparents, we take? Does every Tylenol look the same? No, it doesn't. Does every painkiller look the same or vitamin look the same? No, all different colors. So that is why these narcotics are now being in different colors to formulate and say, this is a real hydrocodone. Look, it's yellow and it has a 10 on it. Little do they know that it's illicitly bought and it's laced already with fentanyl. Okay, and some of the times that these colors are based on is that different cartels use different colors. Okay. And we brought up the reason for them being in Skittles, being found in sweet tarts and Whopper boxes, and the reason is to hide these drugs from law enforcement. You know, it is a odorless, tasteless, fentanylist, and so, you know, they just try and hide these through little boxes so they can escape the law enforcement bust. And we brought that up. We also talked about the opioid response team, what we do. We go out and do intranasal Narcan training for our participants. These are post 911 opioid use survivors. And also we provide them with a fentanyl test strip that the chief was talking about, that we provide for them so they can test their stash, whatever they might have, and see if it's fentanyl laced. Building upon the stuff that we did for fentanyl, it's been already found in vapes. That's already been found. Our counterparts in San Antonio who do the same thing that we do. I just spoke with him 2 days ago. He's saying now these dealers are just sprinkling on weed fentanyl. And so what they do is, you know, in certain markets where it is legal, chronic pain, to give you appetite, things like that. But here they say the same thing, hey man, this is for your pain. Sprinkle a little bit, guess what? Now you want more and more and more. And they just don't know what they're coming out with. And that's been confirmed over in San Antonio already. Yes.
The fentanyl test strips, how much are those?
They're $2. They're $2 each. You can buy a box for 20 or less. And they're on Amazon and just the place when you go to fentanyl test strips, they come out. We buy the BTMX brand. There's other brands out there, but the BTMX is shown to, it's recommended by Johns Hopkins. It's a gold standard for fentanyl test strips. Also, I want to mention that the last time that we did this meeting, I mentioned that we had 300 overdoses. And as of this morning, we now have 325.
Thank you. I wanted you to mention something about that was very critical. Somebody's overdosing, how much Narcan do you have to use? That was just shocking. When you said somebody's overdosing, it's not like, okay, we're gonna use Narcan here and, you know, jump back.
That's exactly right. There are so many different analogs of fentanyl and so many different analogs of these opioids now that some have a long-lasting effect. Narcan can last between 3 to 5 minutes in your body, but if this long-lasting effect of fentanyl or other analogs of these drugs that can last up to 20 minutes, guess what? After 3 to 5 minutes, you're back into an overdose. 3 to 5 minutes, you're back into an overdose. Our medics have given up to 5 or 6 doses intravenously for these overdoses, meaning that these drugs are now more lethal, more aggressive, they're deadly, and more addictive.
So between the last time that we met to now, there's a 25 increase in overdoses.
And so the last time we met, I told you that out of those 300 overdoses, 57 were opioid related, which was 170 cases. Now, as of this morning, 325 overdoses, with 189 of those cases now being opioid related, which now brings it up to 15%. 2 years ago, we had 48% opioid related. There's an increase of 10% within 2 years.
the youngest age this year being 17 so far. And I saw the data that the chief provided, and the youngest death is 17 there.
I mean, those numbers are alarming. There's nothing to follow up with that unless there's questions. I do appreciate you having to make mention from the last presentation, some of those numbers. Because these numbers are very concerning, I hope that all agencies and every commission member goes back and considers doing more to prevent this from happening, because it's a shame. So I do appreciate all the work that the Laredo Fire Department does. I cannot say it enough. The work that you all do, both Laredo Police Department and everybody here, you all do a wonderful job. You're actually working with the client themselves and a person that actually needs help. So I appreciate you all having to do the work that you all do, because not everybody can do your job. Are there any questions or follow-up to?
I do have one more comment, and I'm keep on ringing the bell, but I'm going to ask Guillermo what your thoughts are. This administration and the city of the product, even the village, are hopefully having doctors for the CND is great, because I'm all for medication assisted treatment, but medication assisted treatment that is used where I'm tied right grants out of the way, we use Zilfone, which is injectable naltrexone. Naltrexone in about 1985, the item we looked at the definition more long will be that. Time they found out that naltrexone is no receptor blocker, blocks the receptors, so usually go to overdose and then they have the effects. I mean, they going to withdraw and don't have the effects of that. So it was also found to be effective against alcohol use disorders because it is a dopamine receptor block. Right now, see what we're having here. We have, Vicodin is an antagonist, an opiate antagonist, and so it completely blocks the receptor. It's not addictive, and one shot provides 30 days of coverage, and the use is recommended use of about 13 months. That's something we discussed for when people come out of detox, because there's a 333% chance of heroin addicts overdosing when they come out of detox. Considering everything that the chief can talk about there, I believe that we need to somehow set up a meeting. We only have one doctor in town that we're looking for. And the idea with previous administration was let's set up a CME course where we involve the doctors. We actually, before COVID, had a meeting with, before and after we had a meeting with COVID. We actually, our commission wrote a grant, the Urban Alcohol Commission wrote a grant that was funded for MAT in those plans. But everything because of COVID, it just didn't fall. I'm just seeing what can you all do? Set up something like this so that we can bring in more decisions, because now we're going to have more people dying.
You know, I think today, and I have to thank Chief and with what they said today, but today is a very good indication of where we're going as a committee. You know, calling a couple of meetings ago, we didn't have this quality of presentation, so I am very impressed with where the committee has gone. Listening to what you said, you hit the nail right on the head when you said COVID kind of knocked us down. The focus of the health department is starting to change back into a true health department where we're putting COVID to rest, and now we can go back to the actual education. A lot of people understand, but don't really have it in their head, that the health department's primary purpose is preventative education. For the whole spectrum of everything that's out there. So we're now at a point in time when we can start getting more into the real preventative education and the areas that we want. Unfortunately, we're getting back to the end of the year, and everybody's starting to think about those turkeys and those Christmas gifts. But January is the big month for us. And what I mean by that is Chief, you alluded to the work that we did together with the promotion of this, and you see a lot of new faces at our table today. I want to introduce Mr. Seca, Eli Seca, Mr. Henrik Perez. These are the Health Department Public Information Officers with them as their supervisor, Christina Duarte, the Chief, the Manager of Health Education. I brought them out so they could see this presentation, so they could see the effects of the work they do, and of course that they can learn and meet with everybody. A couple of weeks ago, I told them, let's start planning for January. January is the biggest month where everybody says, I need a New Year's resolution. So the health department has special programs going on, but there's a lot of things that affect our community. I know Dr. Chamberlain and I have been strategizing on what paths to take in the future. AHEC does a great job with a medical update once a year. I really think that something like Vivitrol and the positive effects it has in our community on that population should be part of that.
I agree. I was envisioning in my mind this yellow speak and saying, look, we could have a presentation. Sheriff and fire department, explain what's going on, the overdoses, the doctors have their hands full. And sometimes, they don't hear about it, sometimes they get the naltrexone, you have to call them, give it. But if they understand what's going on and how this could save lives, and how we could help them out in the community, this would be very important. So I want to, having a workshop, the doctor gets seen me, they always like to eat that, so give them some food, and they get some hours. I talked to the CEO of the World Medical Center. Dr. Garcia has how the doctor, chief doctor in charge of LAC, well, I know, he's a doctor that does Vivitrol here. We need to have more doctors, not only for our but for all, that would benefit from this, because we still have a lot of DWIs and have all these issues. So, I'm willing to work with you all and figure out how we can have one of these meetings on behalf of the commission, because for me, this is the big thing. I've seen kids overdose. I work with adolescent heroin addicts, and I have been to many funerals. I've had clients in my private practice that have overdosed on fentanyl, one on fentanyl. And I have another client that has started shooting up fentanyl. And I'm mostly dealing now with a lot of mental health primarily, but these are people with co-occurring issues. And it's very sad when we're seeing these numbers. And by the way, you're still going to have overdoses on Thanksgiving and Christmas. So no matter what, you have turkeys or gifts, there's still going to be overdoses.
No, and I understand that. What I was saying is, in order to get the right group of physicians and medical professionals together, it's probably best to start.
No, I agree with you. I'm just saying, man, this is not going to stop.
It won't.
They won't stop. But I'll be happy to work with you all in whatever ways. I'll give you contact names, whatever we can do, so that as a community we can do something, because Colleen mentioned preventative. And we need to, how are we going to prevent this?
Why don't we do that, Jesse? Why don't you get a list of potential doctors that we could reach out to, and perhaps either invite them to a meeting or invite them to the meet and greet that we're planning on doing. And that way, and maybe it could happen even sooner, start those conversations, because that's the whole point of having to meet and to discuss and bring up these things, because then it gets, the wheels going and saying, I think we need to do this, and I think we need to do that. I think that's a wonderful idea. But if you already have some names already that you probably could,
I'll be happy, because
let's try to reach out to them.
Everything kind of stopped at COVID. And so now let's go ahead and resume it, especially with the data that was provided by last meeting by the fire department, by the chief. So we need to do something. If not, we're going to have community members dying.
I agree. And, as a community, in addition to everything we do here, look for Hyman, look for Eli. If you guys have events going on, if you guys have a message that you need to spread out, send it to them. They're great about sharing on our social media. They know so much more about any of this stuff than I do. So don't send it to me, send it to them. They're the real experts in their field.
Well, what I was actually going to ask is to see if the city would be okay with it, or the commission would actually be okay with it, we do have the Drug and Alcohol Commission Facebook. So maybe I could perhaps add you one or the other, if it's okay with the supervisor, if they would be added to our admins on our Facebook page, and then just add those types of related information onto our Drug and Alcohol Commission Facebook. Mr. Silva, I know you had a comment.
I think she did.
Thank you. This October, I went to the schools, to middle schools and high schools to present upon my son for Red Ribbon Week, and I was telling them that why does it have to only be October for Red Ribbon Week? Why can't it be something, like drugs are there every day, So if we could do more, I don't know, once a month, I don't know, like they have mass messages that the school can send. Maybe we can tell them, remind them something like every day about drugs, or at least once a week, but not just do this on Red Ribbon Week, because, I go and present every year on Red Ribbon Week only, and I'm thinking, like, why does it only have to be Red Ribbon Week? And also the second thing, a lot of the teachers were asking me, where can they get Narcan, or where can they have it there? Because they don't have, they told me, I went to Triumph High School, and the nurse told me that they can't have it there. That she actually has some, on her own, because she went to buy it, but it's not readily available for them, and that's the problem. If more people can get their hands on it, like you said, now it's more like more doses to control what the overdose that they're having. I remember looking over my son's paperwork, and when he had his second overdose, he had 2 doses of Narcan, but that was back in 2016. So what about now? You said it's more, the doses are more strong, and so maybe we need someone, I don't know, Narcan to be distributed. Even I have parents calling me and asking me, what can I do, where do I refer them? And I do refer them to Border Region, I do refer them to SCAN, to Pillar, but if there's something else we can do on board. Yes, ma'am.
I just want to mention, I'm coming from SCAN, Recovery Support Services, and we have a brand new program that is dropping. And one of the main objectives is to inform the community how to use the Narcan and disseminate the Narcan. So we have plenty, we have more than 1,600 Narcans that they can be distributed. So it can be for the agencies and the individuals. So I'm going to pass the flyer. So in case the
Yes, because I do get a lot of.
and please, if the department want us to provide the training that provide the Narcan, because actually we don't have the
And then you would be able to provide to school?
Yes.
Yes, the nurse will call you, okay, perfect, great.
But the issue is that the schools might not be able to.
Yeah, right, yeah.
They don't, yeah. But maybe for the clients, so.
Yeah, for the paramedics.
Go ahead, Mr. Silva.
Okay, I want to get back to what you were talking about, the naltrexone. After research, naltrexone can be prescribed by a nurse practitioner or physician's assistant also. It does not need to be a physician and does not have any specialized training. It's not an opioid or an opioid partial agonist. It can be prescribed by those individuals also, so they include not only doctors, but nurse practitioners and physician's assistants to that meeting that you would like.
Yeah, so nurses, doctor, anyone can prescribe it, but you're absolutely right. I wanted to add on something, Marina, I agree with you that this is something that we have to address every day. But I do want to, because I do know that SCAN has prevention services that are out there every single day, even in the summer. And I do know that schools have, like my wife and different people that are doing things every single day. But it's unbelievable. We've got 40% of high school students in the United States using cannabis vapes. And right now, if you look at the schools, they're being overrun with that. And we have multiple dangers. So I do agree. Every day, you know, way back even when Governor passed away, I thought the same thing. But we had a mission that we have to have every single day. I wake up every morning with different, with this mission to help others help themselves. But you know, there's people out there doing it, and I appreciate it. And you're doing it. I mean, I know that you work really hard over at Ribbon. We got to talk to Alida. And but you know, congratulations to all those that do it. But I didn't want to let it go by. And SCAN has intervention prevention services that go out there every single day, and it's just like we're being overwhelmed.
If I can make a comment on the Narcan, I don't know if anyone else has seen it, I know I shared it with my colleagues. Specifically, I saw one individual selling Narcan on clasificados. So I'm not sure if that's gonna be an issue. I mean, if an individual just sells it, we don't know necessarily what they're selling to people. So is there again clasificados where someone is selling Narcan to people? Yeah.
That's something.
You can,
I know I sent it to my colleagues and I was like, this is a little alarming.
for those that cannot go to SCAN and buy and go get their free dose of Narcan, Walgreens has a standing order. Any one of us can go and buy it. It's a 2-pack for $98. And it's kind of expensive, but that's how much they want. For anyone, a lay person, any parent, anyone just wants to carry it, like we now do with EpiPens, things like that nature, to carry it, just to let you guys know that Walgreens will sell it to you. With a prescription.
And I think that the importance, and I get the discussion and the conversations back and forth, the importance of having, again, these meetings, I cannot stress it, is to bring that information that you all have with your programs and the agencies and your knowledge that you've done through research or through actual findings, bring it to the meetings, or, you know, don't wait for the meetings, share it, send it through the email so that we could put it out there on, you know, social media pages, websites, whatever the case may be, through your clients, through the people that you all serve. That way there is that, you know, you can buy it, or you could get it from an agency, or you could get trained on it, or whatever the case may be. We have a few minutes before we actually close, so I'm gonna go around the room to see if any stakeholders have, any updates or any information regarding your agencies. I know that I wanna make sure that you all get back or close up by 1 o'clock.
I'm sorry, I just wanted to mention very quickly that right now we are opening the program, but the idea is that we are going to be open 24/7. So at any time that someone wants to get remark can be.
Fantastic, thank you so much. The flyers have been passed out. Please put it up there on your agency walls wherever there's traffic and that information is of use. Do you have any information that you all want to share?
Right now, we're still in process with the outpatient treatment program that I believe was discussed, mentioned last month. But we'll keep you posted as we progress. We're also looking for a possible new location as our program is growing, and, you know, we would like to add another counselor and whatnot, but we're in process, and we'll keep you posted.
Thank you so much. Anna, do you have anything to share on that? Do you have anything to share?
I do, for Erica, I'll speak with, Judge Villarreal on behalf of the AOT program, see what we can do to kind of like implement or integrate that into into his case, onto his, cases, and see, I'll go ahead and give you a call to see if there's any feedback or any questions that you may have.
Okay, perfect, thank you so much.
One final note, just historically, in 2001, Laredo, Wood County, had the highest rate of adolescent opiate addicts in the state of Texas, admitted into treatment in 2001. Look at where we are now. We've had this problem for years, and, you know, it's getting worse.
It's unfortunate. Margarita, Mr. Monteverde, do you have anything to share?
Just real quick, we're talking about the Narcan, which is a great assistance in people getting better from the addiction. There's facilities throughout the United States who have their long-term programs, while during these programs, they'll give the clients Narcan, you know, but it's not a magic, medication. It's
not a miracle.
not a miracle, but it assists you know, through the difficult times that the person's going through to get to where they need to get to hopefully get off drugs permanently.
Thank you for that info. Anything else, Mr. Soto, that you want to share?
You guys mentioned keeping fighting all this is prevention. Turn the fire department chief, police chief, Dr. Chamberlain, they sounded the alarm on this opioid crisis, specifically on fentanyl. So what we're doing now is giving classes to the high school students. We just finished up all UISD high school, LISD high schools, and we're starting up with UISD high schools under 9th grade campuses. Okay. So to all grade levels, that's what we're doing. We're focusing on that age group because of the age group that we're finding within our reports.
And you're doing what with the schools? I'm sorry, I didn't hear.
So we do a community outreach. We tell them what an opioid is. We also show them celebrities, you know, because we tell them, visualize a heroin addict. What do you think of? You think of a certain person, but then we show them an array of celebrities that have died of heroin overdose will survive so they can see like, hey, it affects them too. And then we do a life case scenario. So what we do is we portray one of our medics to have an overdose right there and to see what our medics do during an overdose. Then we have an actress there and an actor. And usually the feedback is, you know what? I never want to see my mom like this. I never want to see my dad like this. I never do. So, you know, that's a deterrent factor for them. That's the kind of awareness that we're bringing out to our post-secondary students, our high school students. We also have something lined up for the little college we should be bringing up soon.
What is this presentation called? Or this session with the high schools? Or have you all like formally named it or?
We just call it the community outreach for high school students on opioids.
Okay, got it.
Yes.
Alrighty. Any other, Ms. Vance, do you have any comments or anything that you want to share on behalf of your?
No.
Buddy, you good?
Yeah, I'm good.
All right, so I think we do have a couple of presentations that are still in the community, so that may be something that we put together and maybe make mention through our social media, maybe a news release advising the community that there are several presentations that are available regarding certain topics, and so we'll get with you all. Please share your information and your contact information via email so that we can formalize that and say that we have, you know, presentations on drug awareness and prevention and, you know, resources, and then that way we can get that out there. If there are no stakeholder agency, any other updates or any other information, we are coming to a close. Lunch was provided by the City of Laredo. I do want to ask for the next meeting before we close, if anybody is interested in providing lunch. We do make the meetings available during our lunchtime because it's more feasible and it's more convenient for everybody as opposed to an afternoon meeting. In order for us to continue doing that, we would like for lunch to be provided. So if there's an agency or somebody that would like to donate lunch, please let me know. We have gotten lunch provided by Nancy, myself, Mr. Walls in previous times, and so if anybody would like to volunteer for lunch for the next meeting, our next meeting will be on Wednesday, December 14th at 11:30. Anything else before I adjourn? If not, can I make mention or adjourn the meeting at 12:55? Can I have a motion to adjourn? First by Marina, do I have a second? Second by Nancy, meeting adjourned at 12:55. Thank you all so much for coming out, and please do not leave without volunteering for lunch next meeting.